Thank you for tuning in to another Fast Facts Friday. I'm Josh Troppelman, your Patient Experience Coordinator. We're here today with Dr. Tingler to discuss some screening prevention and treatment of cardiovascular disease. Welcome, Dr. Tingler. Thanks for joining us today.
Hey, thanks for having me.
If you could just tell us a little bit how long you've been practicing out of Fairmont Regional Medical Center and what's your specialty?
Well, I'm a cardiologist, and I've been here at Fairmont for about 10 years. I believe this July will make 10 years I've been here full time. I started a year before that.
Great. Dr. Tingler, why is it so important to promote cardiovascular awareness, especially in women?
Well, especially in women and especially in our state, unfortunately, because it's such a prominent disease in the state and in the country, and it's still the number one killer of all people worldwide, especially in the U.S., and it's sometimes not well known that how common it is in females. We as the general population associate heart disease as a male disease, but I can tell you from doing this for a long time, it's very, very common in women and often goes undiagnosed probably a long time before they get to us as a cardiologist.
Wow. What some of the conditions include that categorize cardiovascular disease?
Well, cardiovascular disease is a very broad topic, and typically we're talking about coronary artery disease or blockages, heart attacks, where people have need stents and have a heart attack and those sort of things. But it also encompasses cerebral vascular disease, strokes, and pretty much the entire vasculature. And then that kind of, in our practice as cardiologists, encompasses heart disease and all the things that lead up to heart disease, such as blood pressure and cholesterol and diabetes and a lot of the risk factors that lead to actual serious heart problems.
And why are women less likely to believe that they're at risk for cardiovascular disease or stroke?
Well, I think a lot of it is because, again, the stigma that this is a male disease, and people in their minds have this picture of what they think someone with heart disease looks like. And I can tell you that oftentimes I have females who are very thin, they look healthy, they don't have a lot of other medical problems, and they end up having heart disease that goes diagnosed as they're just tired or they're fatigued, they have some other type of issue that's causing their symptoms, and their symptoms are definitely atypical or much different than their typical male counterparts. And so I think that's why a lot of them go undiagnosed and don't get recognized and picked up early enough.
Okay. And now, does family history play a contribution in the risk of cardiovascular disease?
Absolutely. That's one of the first questions we ask folks, especially if it's a new patient coming to see me. I ask them, does this heart problem run in your family? And that usually means your mother, father, siblings, brothers, sisters, anybody in your immediate family who's had heart problems, especially at a young age. Some of these heart conditions are hereditary, and if someone's had several family members with heart attacks in their 40s and 50s, very young age, that could potentially make them at higher risk. However, sometimes it could be the lifestyle that leads to the heart disease, such as mom was a smoker, dad was a smoker, they were overweight, those sort of things. But even without that, some people have a genetic predisposition to heart disease, even if they don't have the other traditional risk factors such as smoking and being overweight and those sort of things.
Okay. To our female viewers, if there's some sort of screening or prevention that they could do now, early, what would you recommend?
Well, the first thing is what we recommend to all patients in general is just talk to your family physician, or if you don't have one, get one and ask them, am I at risk for heart disease, and go over some of the common risk factors. And those things are, again, high blood pressure, high cholesterol. If you're a smoker, again, if you have a strong family history of heart problems, just at an older age also makes you at higher risk. And then especially if you're a diabetic, if you have chronic kidney disease, any of these other type of called comorbidities that make you at higher risk, those by themselves put females at risk. And then the symptoms, if they have symptoms that could be heart related, it doesn't have to be typical chest pain. It could be, they feel tired, they have malaise, they're not sleeping well, they may oftentimes feel short of breath. The symptoms can be very vague. They don't often come to us with the classic chest pain down my arm, shorter breath, these sort of things. There's some of those, but typically it's much more subtle, and you have to dig a little deeper. So main advice to females is to talk to your family physician and go over your risk factors, because some of them are modifiable, such as if you smoke, stop smoking. If you have high blood pressure or cholesterol, those can be treated. Family history and age, we can't change those, but they can be something that makes your physician look deeper to those other risk factors and help modify those.
Okay. If there's one thing our female viewers would take away from, knowing about cardiovascular disease, what would you want them to take away from today?
Well, again, like the whole topic about heart disease awareness in women is knowing that this is not just a male disease. Females are just as likely to get heart disease as their male counterparts, and some even more so if they have enough risk factors. So I think our main takeaway is for females to be aware that heart disease is very, very common in females. It's still the number one killer both in males and females, and to not blow off their symptoms or think because I don't have chest pain or I've never been told I had heart problems that I'm not at risk, because unfortunately sometimes the most common presentation for heart disease is a heart attack, and certainly as cardiologists, cardiovascular specialists, we like to prevent that from happening, and sometimes that means getting referred by your family physician to a cardiologist sooner, or having screening like we're doing here at Fairmont General.
Great. I just want to thank you for taking some time out of your day to go over cardiovascular disease in women. I greatly appreciate it.
It's been my pleasure.
Thank you. I want to remind everyone, Fairmont Regional Medical Center is hosting a Go Red for Women. The event's going to be on Tuesday, February 5th. It's here in our hospital. It's going to be free screening and education. We're doing free EKGs, blood pressure, carotid ultrasounds, and we're going to have providers talking about cardiovascular health, education, medication history. So it's going to be a really good educational process for coming in. If you want to sign up for one of these free screenings, you just need to call our scheduling department here at Fairmont Regional at 304-367-7171. That's 304-367-7171, and we'll get you scheduled up for that. And as always, if you ever need us, we're open 24 hours a day, 7 days a week, and it's going to be on February the 5th, Tuesday, in our lobby here at Fairmont Regional.